the chapter on the autonomic nervous system. And I think this is actually a very important chapter because I think a lot of the medicines and drugs that we use in medicine affect the autonomic nervous system. I mean, I take a drug called a beta blocker. A beta blocker means it slows down the beta receptors that go down my vagus nerve, actually down my sympathetic nerves, to make my heart beat faster. And I take a beta blocker which blocks it to keep my heart from beating fast, keep me from fainting, actually. But almost all the blood pressure pills, almost all the heart pills are all related to this autonomic nervous system. And I think the thing about the autonomic nervous system is that it's really rather straightforward. Just pay attention for the next 5 minutes, and this is so important. The autonomic nervous system is the one that's kind of the automatic nervous system, as I've said. It's kind of out of our awareness. We don't say, I need my heart to beat faster, or I need my stomach to digest faster, any of that stuff. It just happens because of this nervous system. Now, this is kind of weird, I think, but it has two divisions. One is called the sympathetic nervous system. It has nothing to do with sympathy. And the other one is called the parasympathetic nervous system. Okay? Now, let's think about it. The sympathetic nervous system is what we call the fight or flight nervous system. Now, what does that mean? Well, it means that that is the system in our brain that gets us ready to either fight or to run away, to save our life. Okay? Now, if you think about everything in terms of that, then all of these other processes, I think, will make pretty good sense. And so as we go through this chapter, you're going to hear me talking about the tiger in the room. Okay? So if we were all sitting here in the room, and we looked over there at the door, and in walks a big tiger, what do you think would happen to your heart rate? What do you think would happen to your blood pressure? What do you think would happen to your respiratory rate? What would happen to the depth of your breathing, how deep the breaths are? What do you think would happen to your blood sugar levels in your blood? They're going to go up too. Why? Because you're going to want to have lots of sugar in your blood so that if you've got to run or if you've got to stand here and fight that tiger, you're better equipped to do that. How about your muscles? You think they're going to start crying out for more oxygen? You think they're going to increase their metabolism? Yes. Pretty much everything across the board is going to increase. What about the diameter of your breathing tubes? So you've got this circular muscle around all your bronchi that allow air to come in and air to come out. What do you think is going to happen to those muscles that surround your breathing tubes? They're going to dilate up so you can get more oxygen in and more out. Anybody have a kid with asthma?
I am a kid with asthma.
You are a kid with asthma. Okay. Well, I don't know how bad your case is, but when you have a pretty bad case, do you carry an EpiPen?
I don't, but I have my inhaler.
You have your inhaler. Okay. All right. Well, I'm going to tell a story then and not use your case. I taught at the high school in our town for a while with my kids, and it was kind of fun. And one day we were walking down the hall, and we had the smell of peanut butter cookies. It was just going through the whole hall. It was just, it smells so good. And suddenly there's all this ruckus, and people are running all over the place. And this girl, who was the daughter of the police chief had collapsed in an anaphylactic reaction to peanuts. Just she had inhaled some in the air that we were all smelling, and it caused her heart to stop, her to quit breathing. She was unconscious laying on the floor. She was having an acute asthma attack, and more than that, she was having an anaphylactic reaction due to a reaction to the protein in the air. Somebody said, "Doesn't she have an EpiPen?" And somebody said, "Yeah, she's got one. It's in the office." So somebody goes running down to the office. They come running back. Does everybody know what an EpiPen is? EpiPen is a little thing that looks like a heavy-duty pen. You have one? There you go. She's a good mom. I bet it's for a kid, right? Or is it for you? It's for you.
Oh, maybe I don't have it. Maybe I'm bad.
Well, anyway, I'm going to just use this as it's about twice as big as around as a pen, and folks carry them with them all the time. And if they start to have a reaction, they basically can just take it and thump it on their leg like that, and a needle comes out of one end of it, and it has an automatic injector in it, and it automatically injects you with epinephrine. Okay? So epinephrine is a drug that makes you want to fight or flight. Okay? Epinephrine is a drug that runs the sympathetic division. There's another name for, here's an EpiPen right here. The needle end is,
You can take it out of the
no, that's okay. We get that confused with a lot of things, I would imagine.
Oh.
Please. Anyway, we have another name for epinephrine. Anybody know what epinephrine, the drug name is for epinephrine? Adrenaline. Why is it called adrenaline? It came from your adrenal glands, that's right. The original company to process it was called the Lilly Drug Company, and they found if they went to the slaughterhouse and took all the adrenal glands out of all the cows and all the pigs, they could kind of turn them up and separate it out and get the adrenaline out of it. And you guys have all listened to Monday Night Football, and then somebody says to somebody, "Oh yeah, that guy, he's really playing, he's all juiced up on adrenaline. You can just see it in him. He's really hopped up on adrenaline tonight." Well, that's what the sympathetic nervous system does. It prepares you to fight or flight with the tiger. Okay? So that's the fight or flight division of the autonomic nervous system, which is basically the sympathetic half of it. On the other hand, the parasympathetic system is the other half. And the other half, the parasympathetic system, is referred to as the rest and digest system. So after you've fought the tiger, after you've killed the tiger or run the tiger off or something, it's time for you to rest and digest. So if your parasympathetic system is very active, what's going to happen to your heart rate? It's going to go down. What's going to happen to your breathing rate and your blood pressure and so forth? Let's go back to that fight or flight with the tiger. While you were sitting there looking at that tiger in the room, do you think your food was digesting any in your system? Absolutely not. Your body works in such a way that the impulses going to your stomach just stop. They don't, your stomach quits churning, your intestines quit churning. The blood that was pumping like crazy to your intestine just stops. And so you really don't digest your food when you're in a fight or flight situation. I'm trying to relate that to something that you may have thought about before. If you have ever run a marathon, you probably have noticed that they really don't put any food out for you along the way. Maybe there'll be a banana or something, but not much, because what happens to anything you eat, you put in your stomach while you are exercising, while you're in sympathetic output. You're wanting to send all your muscles, all your blood to your muscles and your lungs and your heart, right? So most people get sick at their stomach. Whatever they put in their stomach, they get sick and vomit it if you feed them anything while they're still running. Something to think about.
Is that like active labor?
Yeah, active labor sort of does the same thing. You don't really, if you eat during active labor, it's probably coming up because you're not going to be sending any blood flow or any nervous impulses to your guts to make them push the food along. And if it doesn't go along, it's going to come back up. Okay. So, one more question. How about your kidneys? When you were looking at the tiger in the corner, do you think you were sending a lot of blood to your kidneys to make pee? No, you weren't. Because you want to send all that blood to the other areas that we talked about, that you need the blood for in order to be able to fight and flight. But now it's time to rest. Now it's time to filter your blood. Now it's time to send blood to your kidneys. Now it's time to send blood to your intestines and so forth. Now it's time to have sex. Now you wanted a question.
Then why do people pee themselves if they're really when they're in a scary situation?
Well, that's not. They're not making urine. They're just releasing it.
Okay.
Yeah. That's when you want to have sex. Parasympathetic. It takes parasympathetic output to get aroused for sex. You can't be looking at the tiger in the corner of the room and get an erection. It just doesn't work that way. Okay? I'm trying to separate these things out for you. I had a little girl in my class 2 terms ago. She sat right about there. And if that subject ever came up, I swear you thought you were spraying her with red paint. It's just more than she could deal with. But I guess we're all that way to some degree. I have no idea where I left my clicker. Here it is. Okay. So that's the sympathetic, fight or flight, parasympathetic, rest and digest. Okay? Now this will probably review that a little bit. The sympathetic division is the fight or flight one, and it only kicks in during exertion, stress, or emergency. In other words, we don't sit around with our sympathetic division firing all the time. If we do, we got a problem. We probably have super high blood pressure, we have fast heart rate. It's not healthy to be in that adrenaline rush all the time. The parasympathetic system, as I said, controls things during the resting conditions. So it's the interplay of this sympathetic and parasympathetic systems that keep us in line. Okay? Send the blood to the things we need to have blood to when we're in fight or flight, and send the blood to things we need to have blood sent to when we're in rest and digest. Okay? A lot of the divisions, the 2 divisions, for example, they both work on our heart. We have sympathetic fibers that go to our heart. We have parasympathetic fibers that go to our heart. The sympathetic fibers make our heart beat harder, faster, and more beats per minute. Okay? The parasympathetic fibers, they slow your heart. They make you faint. They lower your blood pressure, and so forth. Okay? The 2 divisions may work together in some things. We'll talk about how they actually work together in urination. We'll talk about how they both work together in sex. But they each, in those cases, they each control one stage of the process. Okay. Now, there's an anatomic difference between the 2 systems as well. And so let's just take them one by one. The sympathetic system comes out of the spinal cord. It's not all the way from the brain to the feet. It's only from T1, thoracic 1, to L2. Notice there are no cervical, in the cervical vertebrae, there is no sympathetic nervous system. It only comes out between T1 and L2. And we have some really nice models that illustrate this for you. But once they come out of the spinal cord here and they hook up with what's called the sympathetic chain ganglia, which runs from the inferior lumbar, runs down the back. They actually run up from the from T1, you see, which is the first segment here has fibers, but then they hook into the sympathetic chain ganglion, which goes up a little bit. So that basically we have sympathetic fibers that go to our whole body. Then these nerve fibers go to the chain ganglia alongside the spinal cord, and then they go back out and they join up with other nerves. They join up with cervical nerves, lumbar nerves, sacral nerves, and go to all the different areas that they need to go to. We'll talk about that anatomy a little later. So the sympathetic fibers, these preganglionic fibers, come out of the spinal cord, go to these sympathetic chain, which is part of the sympathetic chain ganglion, running alongside the spinal cord. And then there's the postganglionic fiber. So there's a preganglionic fiber that goes to the ganglion, and then there's a postganglionic fiber that goes from that chain ganglion, which is right next to the spinal cord, goes all the way to the organs that it's going to. So therefore it has what we call a very short preganglionic fiber and a very long postganglionic fiber. The postganglionic fibers can go as far as from, say, up here, that sympathetic chain ganglion back here. They can go all the way down to your foot, and down there they can control the arteries and how far they're open or closed. They control the dilation or the contractions of the arteries to allow more or less blood to go to one area or another. They also have fibers that go all the way from here, and they actually go right into your heart and control your heart rate and so forth. So remember, sympathetic fight or flight stimulates all your tissue metabolism. I think it's important that you understand that this fight or flight thing isn't just, oh, let's be aware, let's look at that tiger, let's think about getting juiced up and getting energetic and ready to go at it. It also involves all your metabolism systems, like your blood sugar, and like start breaking down starches right away. You start breaking down fats right away. You start doing all these metabolic things to provide your body, provide your muscles and your heart and so forth with the chemicals that it needs to make all these things happen. Make sense? Increased alertness. One other thing I failed to mention when I was talking about the tiger in the room. We're all sitting here, and the tiger walks into the room, and what do you think happens to our pupils? They get bigger, that's right. They get bigger. Why? To let in more light so we can see that tiger better. Okay? So sympathetic output is dilate. Parasympathetic output is contract. Because let's face it, when you're having sex, you don't really need to see everything. You can have less light. Right? I see you shaking your head and laughing at me. It's the truth. All right, so here's kind of an anatomy picture of this. I told you that the sympathetic fibers, this is an example of one, they come out of the spinal cord between T1 and L2 or 3. These are the preganglionic fibers right here. They come out, they go out through the ventral root. It's motor. Now, these are motor fibers. And it goes right out here, and here's the dorsal root, right? Here's the ventral root. They come together to form the spinal nerve. That's the spinal nerve right there. and it doesn't stick together very long. It breaks up pretty quick, but that's the spinal nerve. So that might be, T2, T3, one of the spinal nerves. And it goes out of the nerve, and it goes out through these little, this little ramus here called the white ramus, and it goes right into this sympathetic chain ganglion right here, and it synapses, and then some of the fibers go back in to the spinal nerve, and then they go on out and follow and go innervate things. So all the sympathetic fibers come out of the spinal cord, go into the sympathetic chain ganglion. They go ahead and they synapse here, and then they either follow a sympathetic nerve, or they go on out and follow one of the spinal nerves to go to wherever they're going. I hope that makes some sense. Now, this picture also shows these two things. What are they? Those are the adrenal glands. Because a very important part of the sympathetic system is the adrenal glands. And they basically, when they get stimulated by that tire walking in the room, your adrenal glands basically squeeze down and release a bunch of epinephrine. Now, they don't really squeeze down, but they just release a lot of epinephrine. Why? Because there's nerves that go from our brain to our adrenal gland that fire off and signal all this release of epinephrine. So here's the sympathetic chain back here in the back. Remember, T1 is the first one, but then the chain ganglions go up a little bit higher than that. And here's all of these sympathetic fibers going to the eye. Sympathetic fibers going to the eye are going to cause your eyes to dilate. Sympathetic fibers that go to your salivary glands are going to make your salivary glands. Huh? What?
Salivate.
Make spit, yeah, salivate. They're going to go to your heart, send some to your heart. It's going to make your heart beat faster, beat harder, and so forth. Blood pressure to go up. It's going to send some fibers to your lungs, which are going to make your bronchial tubes open up, like that girl who got that EpiPen, and the adrenaline, the epinephrine, caused her airways to open up, stimulated her heart, to get her heart beating, and she was fine, by the way, in case you were wondering. Yeah.
Why do you salivate more?
I guess.
Ready to do some fast talking?
Do some fast talking. What's the real reason for that? If you got to run a lot, I guess it's going to make it easier. You can breathe a lot better if your mouth is wet. If you're gonna fight the tiger in the old-fashioned way and fight him on the neck to try to kill him, maybe that helps too. That's a good question, but I know that's the way it is. Okay, so we talked about the chain ganglions off the spinal cord, but here's the other half of it, and that has to do with the suprarenal medulla. Now, the suprarenal gland is another name for the adrenal gland. Suprarenal means it's just above the kidney. They sit on top of the kidney. We used to always call them the adrenal glands. We used to do adrenalectomies, but now, for political rightness, I guess, we call it the suprarenal glands. The medulla is the center part of the adrenal glands, and it's an area of the adrenal that we'll talk about a lot more in the endocrine chapter here in a couple of chapters, but also it's basically a hormone gland, and the hormone that the medulla makes is mainly epinephrine. Epinephrine is also called adrenaline. It's about 70 to 80% of the secretory output, but there's also some norepinephrine, which is kind of the brother to adrenaline, called noradrenaline. They're both very powerful. They both affect the heart, blood pressure, and so forth a lot. In when the adrenal gland is stimulated in the sympathetic outflow, which we would call it, it releases all this epinephrine. But remember, it's an endocrine gland. What does endocrine gland mean? Let's see, there was endocrine and there was exocrine. What's an endocrine gland? What? Secretes inside the body. Yeah.
Hormones.
It's a hormone. It doesn't really go anywhere. It just releases it out into the interstitial fluid around the cells, gets picked up by the bloodstream and carried around the body. Whereas exocrine glands, what do they have? They have ducts. So like parotid gland has got a duct that carries the spit into your mouth. The liver has a bile duct that carries the bile into the intestine. Pancreas has a duct that carries the pancreatic juices into the intestine and so forth. So exocrine means it has a duct. Endocrine means it doesn't have any ducts, it just secretes it out around itself. Day 2 of 231, by the way. Just thought that last week. Well, you know, 231 students are so amazing. They just sit there and you just feel like you're blasting them with stuff because every word is totally new to them. You guys remember how it was. It's pretty crazy. I don't like to blast them, but that's just part of the job, I guess. So anyway, the bloodstream carries those neurotransmitters around through the body, causes effects on all kinds of things. Basically, it affects the metabolic activities of all the cells that don't have a sympathetic nerve going to them. Because epinephrine, once it's in the bloodstream, it's going to go to every cell in the body, right? Epinephrine's effect does last longer. In other words, just because the tiger walks out of the room and you've gotten all amped up on adrenaline, it doesn't all go away instantly. Okay? It's going to take you a while to come down off of that fight or flight high, so to speak. 7 responses to increase sympathetic activity. Here's something you ought to know. It's going to make the tiger walked in the room. You've got heightened mental alertness. You've got increased metabolic rate. You've got reduced digestive and urinary functions. You're not making urine. You're not digesting your food. Your energy reserves are activated. You start breaking down fat. You start breaking down the strings of carbohydrates that are stored in muscle are called strings of carbohydrates that are stored in muscle in your liver are called glycogen. You start breaking down glycogen right away to free up more sugar, right? Come on, guys, you remember that biochemistry? Okay, so all these energy reserves are activated. You start breathing faster, your respiratory passages dilate so you can get more in and out. You get an increased heart rate and blood pressure, and your sweat glands start sweating. Why? Because if you're getting ready to fight or flight that tiger, you're going to sweat. You're also going to build up heat, and you want to start getting rid of it. Maybe if your skin's all sweaty, he can't hold on to you quite well either. I don't know. All right, I'm going to stop right here because it's more than just epinephrine. There's these other receptors, alpha 1s, alpha 2s. Anybody who has an inhaler needs to bring it tomorrow next time because most all of the inhalers are these things. They're all of these alphas, betas, alpha 2s, and so forth. That's what you're inhaling. It's easier on your body than inhaling epinephrine all the time, but the whole idea is to get those airways to open up, make it easier to breathe. Got it? Okay. I have some quizzes to give back. Let me give those back as you leave here, or as you. I'll just give them back to you right now. I think you saw I posted the grades. Everybody happy with their grade? Some of you are, some of you probably aren't. Key. Oh, this guy Hal Sessions, he did well. Huang Yin. Perfect paper. Katja Anderson. Perfect paper. Elizabeth Garside.
Oh yeah.
Almost 21.5. We'll call it a perfect paper. Lisa Poulsen. Perfect paper.
Oh, it's well.
Hussein Sherpa.
Just because it's
Perfect paper.
I knew.
Or Simona. Oh, I'm sorry. That's it. That's all the perfect papers. These are all posted. Or Simona. Erica Gertis is not here, I noticed. Tiffany Stoker. And Dania. Mukhtar. I said that right? David Choi. Monk Chill.
Supposedly.
Cecilia Lopez. Julia Taylor. Julia. Susie Michaud, she's not here either.
I know. Yeah, right.
Gina Daniels. Reviewing Kyle. Look at Brian Hins. Yeah. Keep up with it. Diana Bodnarsko. Did I do okay? I'll pass that back to her. And Licia Lyanshenko. I'll pass that back. This is the one that I got. Caitlin Morton. That's my goal. Patrick. Sean Patchett. Sean. Robert Nien. Tristan. Amina Hussein. Dan Turpin. Jenny Samielli. Taylor Hobby. Margarita. G. Like a strawberry margarita. What's a margarita G? There she is. Yeah. Okay. Everybody get one back? See you in the lab.
I have to go out and move my car. Can you not show these videos until I'm in class?
Yes, ma'am, I'll do that. You just tell me when you get there.
Alright, I'll tell you when I'm there.
Either I'm gonna hand you my bag right now.
I just want to see. I wanted to snoop a little bit. I'm the best at it.
There's some really fancy stuff there, like my CRNs. Okay, I told you at the end of class the other day that a number of these sympathetic neurotransmitters, there's several of them. In other words, there's more than just epinephrine and norepinephrine. And so, and they affect different kinds of receptors. And most of the inhalers that people take, if you think about it, what they're trying to do when they take that inhaler is they're trying to get the smooth muscle in the walls of their breathing tubes to open up to let more air flow through. Usually they're either partially asthmatic or they've got chronic bronchitis or something, but they need more air. And to get more air, they need their smooth muscles in their bronchial tubes to open up all the way down. And so that's what most of these inhalers are all about. And, you know, my daughter used to get exercise-induced asthma, basically. And so she had one in all of her athletic bags, her softball bag and her rugby bag and so forth. because when she was exercising, that's the only time she'd really ever have troubles. Some of you guys have inhalers, and they work. They work really well for many of these things. So anyway, alpha-1 receptors is the more common type of alpha receptors. The way these work, but I don't think you need to memorize all of this, is that they release the intracellular calcium. This is we see the alpha receptors a lot in the heart. They make the heart beat faster and harder, and it does that by releasing intracellular calcium ions. I apologize once again. I got a message just a few minutes ago that my daughter got her house. She got the keys to it, and they were moving in.
Yay! You gonna go help this weekend?
I hope not too much. I'm only doing light stuff. I'm tired of carrying heavy things. So anyway, you remember that the calcium, it's the release of the calcium that causes the muscles to contract, same way in the heart muscles. So that's the way the alpha-1 receptors work. They're very excitatory. They make the muscles, the cardiac muscles, for example, work very much harder. Alpha-2s work by lowering cyclic AMP. They inhibit the cell. So these are the guys that alpha-2s are a lot of the breather ones that work in the bronchi mainly. Beta receptors here, they affect many kinds of membranes, especially in the heart and liver. They increase the level of intracellular cyclic AMP. Remember, cyclic AMP was another one of those mediators, chemical mediators that make these things work. Beta, I take a beta blocker. Okay, we have beta pills you can take to make your heart work harder and faster. Lots of Americans, including this guy, are on a beta blocker, which causes your heart to slow down and actually brings your blood pressure down a little bit. But mostly it blocks, it makes it slow down, which is kind of nice. This is also the beta blockers were the drugs that all of the shooters in the Olympics were using as a performance-enhancing drug. You know, those crazy guys, they do that cross-country skiing for about 10 miles, and then they'd throw the gun off their back and lay down and have to shoot 5 targets, And in order to do that, they had to calm themselves down really fast and relax, slow their heart rate down. And that's why they were all taking beta blockers, to slow their heart. So every drug can be a performance-enhancing drug for some sport. How's that sound? Beta 1s, beta 2s, beta 3s. Once again, I'm just going to mention them to you. But just know that these are beta stimulants, and they make your heart beat faster, and they make your smooth muscles along your respiratory tract open up. So basically, it's important. These both work great on your heart or on your breathing. Let's talk for a minute about this other neurotransmitter called they're called the nitrooxydergic synapses, and that's a fancy name. It just means they work on nitric oxide, not nitrous oxide. Anybody know what nitrous oxide is?
It's for your car.
What?
It's for your car. It makes it go faster.
No. Nitrous oxide is laughing gas. It's used in anesthesia in combination with lots of other drugs. If you've had conscious sedation dentistry, you go in, the dentist puts a little thing on your nose, you get nitrous oxide, and you kind of zone out. It's not a great anesthetic, but it's enough to make it so you can stand being in the dental office. I hate being there. Anyway, this nitric oxide, however, is a cousin of nitrous oxide, and it works to innervate the smooth muscle in the walls of certain special places in order to produce vasodilation and increase blood flow. These drugs, the nitric oxide drugs, are the drugs that make Viagra work, make the whole class of erectile dysfunction drugs. It's kind of weird that it's actually a gas. Nitric oxide is a gas that is this that is this neurotransmitter, but it works on all these special, very special neurons down in the in certain areas. It seems that they work really well, by the way, I'm told. This is so funny, y'all ever see the movie about it? There was a movie about this drug salesman. It's kind of cute, actually. He says, "I got the greatest drug in the world. People will pay anything for it." I mean, what man wouldn't pay $100 for a pill that would give them an erection that lasts for 2 or 3 hours and whatever? And that's kind of the way it worked. And when the detail man, the drug salesmen were coming around, they just dumped them on us. They wanted us to give them away to everybody because they knew that it worked. And once people tried it, they saw that it worked. It has become the #1 drug in the history of the world in terms of money. So just know that it works off of nitric oxide. Got that, Simona? It's a gas, yeah. Those are all sympathetic drugs that we were just talking about. These are parasympathetic drugs. We want to talk about the parasympathetic part of the whole autonomic system a little bit. So we've talked about the fight or flight group, that half of the system. Now we're going to talk about the parasympathetic, the rest and digest type of nerves. The thing that's different about them is the preganglionic fibers start up in the brainstem and some in the sacral segments of the spinal cord. So this one's called the craniosacral division. And they go to a ganglia. The one nerve goes all the way out to the ganglia. And in general, the ganglia is very close, or actually even within the target organs. So there is a ganglia, a collection of nerve cells on the heart itself, embedded within the heart muscle, that receives these in order to slow the heart down, rest and digest, right? There are other ganglia that are in the lungs to tighten down the airways and so forth. The thing about it is, so this preganglionic fiber that goes from the brain all the way to the ganglia that's on the organ, that's a long one, but then the postganglionic are very, very short, just going into the heart itself. And your book has nice diagrams of that. There are ganglia throughout the abdomen that go to the different organs in the abdomen that make these are the ones that tend to make you digest. So they make your digestive system go faster. Okay. How do they get there? They don't just go through space. What they do, all of these parasympathetic nerves, and the biggest one, the wanderer, remember, the vagus nerve, is these parasympathetic fibers jump on other nerves. They just go along for the ride. They follow along. Oculomotor, facial, glossopharyngeal, and vagus. Now, what kind of parasympathetic fibers would go on the oculomotor? Remember we talked about the oculomotor controls the intrinsic muscles that are in the eye, and if we were parasympathetic, we were resting and digesting, what would we want to happen to our pupil? Yeah, we would want it to shrink. So these parasympathetic fibers that are going to go to the pupil jump on and ride with the oculomotor nerve just to get through the body, and that's how the parasympathetic fibers get there. Parasympathetic fibers are going to make the pupils contract. Facial fibers, there's some some of the glands, don't they? The facial nerve gets some of the spit glands, I think, and so forth. Glossopharyngeal down the throat, and vagus nerve goes to all of these organs in the abdomen as it wanders around. So these are just parasympathetic fibers that are jumping on with these cranial nerves in order to get to the place they need to go. Please, you do not have to memorize any of those routes. But it's probably reasonable to know that these four nerves here, 3, 7, 9, and 10, are the ones that carry parasympathetic fibers out to the different organs. The biggest one, of course, is the vagus nerve. It carries the most. I had a girl in my 231 class that stands up and she's walking up to me in lab and she says, Dr. Sessions, I think I'm about to faint. She said, I have these vagal attacks from time to time. And she looked like hell, and I said, well, let me just grab you and lay you down on the ground. If you're going to faint, let's faint from the ground instead of fainting from up here. And so we did, and you know, she felt okay in about 10 minutes. But we call these vagal effects because the vagus carries so many parasympathetic fibers that occasionally we have these little attacks where the centers up in the brain just start sending out all this parasympathetic information. And remember, it's rest and digest. And if you're standing up and you've got to pump blood all the way up to your brain, and you need your heart to keep beating pretty fast, and you need your blood pressure to stay pretty fast, or pretty high, in order to pump that blood uphill to your brain, it's kind of a bummer when it doesn't happen. So the vagus nerve is very important in terms of carries a lot of these preganglionic parasympathetic fibers. Go into the neck, all through the chest, all through the abdominal pelvic cavity, as far as the distal portion of the large intestine. About 75% of all of the parasympathetic outflow is carried on the vagus nerve. Okay, so 75% of all of the rest and digest fibers are on cranial nerve number 10. But remember, cranial nerve number 10, called the wanderer, goes to almost all the organs in the chest and abdomen. Because these things are just jumping on the cranial nerves to go down there and ride along with them, sometimes there's even sympathetic fibers in the same nerves as well. Here's what I was trying to illustrate or talk to you about. Here's this is the preganglionic fibers. And remember, in the sympathetic system, the preganglionic fibers were very short. The only place they went to was to those sympathetic ganglions that were running right down alongside the spinal cord. Remember? And then it had kind of a long postganglionic fiber. These are just the opposite. The parasympathetics have a long preganglionic, and see, the ganglions are located right on the structures themselves. So right on the lungs, right on here in the lungs, right on the heart, right in the salivary glands, right in the eyeball, like we talked about, and so forth. Not right in the eyeball, but on the ciliary ganglion, which is real close by. I don't expect you to learn all these ganglions, but just know that there is a ganglion because there are two fibers that go to all of these different structures to make this system work. I've already said parasympathetic is rest and repose. The parasympathetic does a lot to stimulate your visceral activity. You guys have all had the experience when you get real nervous or something happens and you just get these incredible cramps in your abdomen and you just got to run to the bathroom. That's a parasympathetic outflow. That's where you're getting a whole lot of parasympathetic fiber and activity sending messages out to your intestines, and you just kind of got to go. The same thing happens with your bladder as well. So whereas the sympathetic system was designed to get everything up and cranking and ready to work really fast and raise your blood sugar and all that stuff, basically everything in the parasympathetic slows you down. Heart rate goes down, blood pressure goes down, and so forth. You make more salivary and digestive glands so you can digest your food better. Increase motility and blood flow in the digestive tract, that's what I was just talking about. And it also can stimulate you to both urinate and defecate. I think I've said all this before, and I don't want to say it again. Really, just know that it's carried on these four nerves here. All the parasympathetic division starts up in the brain and the brain stem, the mesencephalon pons and medulla, and gets carried out to the different organs. I think that slide's appeared before. The other thing is, I told you this is a difference between the two systems. I told you that when you get all jazzed up and you're all full of adrenaline, and you've had the fight or flight because here's the tiger in the room, and your sympathetic system pours out all this stuff to make you go fast. It takes a while to come down from that, an hour or two, oftentimes, to get your blood pressure and your pulse and so forth back to normal, because you've stimulated your adrenal glands, which have released a lot of adrenaline. Anyway, the parasympathetic system is just the opposite. It goes away within seconds. Now think about that. If you're in the rest and repose and you're sitting around and you're thinking about you're eating, you're digesting, you may be even thinking about having sex, and then and you think, well, I'm going to just keep doing this for the next 6 hours or so, right? But the fact is, if a tiger walks in the room while you're all relaxed, you don't want all that parasympathetic activity to continue. And as a result, the parasympathetic system, the way it works, is it only lasts a few seconds. So 5 seconds from the point where you're resting, relaxing, and digesting, and something else happens that makes you want to become sympathetic, you can become sympathetic like that, because the effects of the parasympathetic system are very short-lived. That make sense? So this is just a reiteration of things we've already talked about, but basically the major effects of the parasympathetic system are constriction of your pupils to restrict the amount of light entering, because remember, you're resting. It increases the amount of secretion by your digestive glands, so you start making more pancreatic juice, more bile from your liver. You start making more hormones that are going to allow you to absorb all those good things that are sitting in your gut, so you're going to digest them. It's going to change your blood flow and glandular activity, especially if those activities are related with sexual arousal. Increase in smooth muscle activity along the digestive tract. That's why you may suddenly have to go to the bathroom, why you may suddenly have to go to to urinate, and why with too much parasympathetic activity you actually can get constriction of your respiratory passageways and then not be able to breathe well enough. It's also going to slow down your heart, and it's going to slow down the force of contraction of your heart. So this parasympathetic system is important, but it's probably not as important as the sympathetic system, at least for your longevity and for your life. Although in our modern world, if our sympathetic system is acting too much, and we're running around with a fast heart rate, and we're running around with high blood pressure, those are all bad deals. So it's always a balance between the two. Most of the organs have dual intervention. In other words, the heart has sympathetic fibers going to it that make it go faster, and it has parasympathetic fibers going to it that make it go slower. It has sympathetic fibers that go to it that make it beat stronger, and it has parasympathetic fibers that make it beat slower and easier. So a lot of the organs have dual innervation. And I think I'll just leave it at that. Obviously, your crisis of fight or flight will increase your heart rate, both by some stimulation of your sympathetic innervation, but also by inhibition of your parasympathetic innervation. But remember that the parasympathetic innervation only lasts for a few seconds. So if you don't do anything, your parasympathetic stimulation is going to go away in just a few seconds anyway. The third division of the autonomic nervous system. First one, sympathetic. Second one, parasympathetic. Third one is the enteric nervous system. Enteric nervous system, what do you figure it does? It goes to the walls of the digestive tract. when we get to the digestive system, one thing you're going to learn is that most of the digestive system doesn't need your brain to tell it what to do. Most of the activities of your intestine are caused by the intestine itself. In other words, just one example. When you eat food, it goes into your stomach makes a bunch of acid, and then that acid gets ready to be emptied out of your stomach. About 2 hours later, all the stuff starts dumping out of your stomach. Well, there are hormones that are released by the wall of the duodenum that stimulate the stomach to quit making acid. And those same hormones stimulate from the duodenum, the first part of the small intestine, go and stimulate the pancreas and say, pancreas, we got all this acid stuff that's coming down from the stomach. Can you make a bunch of bicarb? Can you make a bunch of alkaline material to dump in here and neutralize all that acid? And that's indeed what it does. But it does it through hormonal links, and these hormones are actually made by cells that live in the wall of the intestine. So even though we're here talking about the enteric nervous system and how the brain controls our bowels, I think it's important for you to know that it's a pretty minor effect. Most of the effects that stimulate or slow down the activities that go on in your digestive tract are kind of controlled by your digestive tract, and many of them are controlled by hormones, which we'll go into at length when we get to the digestive system. I don't want to talk about that. Let's talk about being awake. Let's talk about being conscious. First of all, being conscious, most all of y'all are conscious at this point. I think you all are. That's a good thing. You know, and we have differing levels of consciousness that we can go to. The first one, which we all pretty much do some of every night, is we go to sleep, right? And sleep is another level of consciousness. It's not wide awake and brown, bushy tail and all that stuff. It's sleep. It's allowing your brain to rest. We can go farther down than that. We can go down to a state called coma. Yeah, we can go down and we could be in a coma, especially if we had some injury, if we'd had too much to drink, if we'd had too many drugs that might put us in that state. So let's face it, lots of things affect our brain and determine our level of consciousness. And just a quick few words on some of these things. Sleep obviously has an important impact on your brain. It doesn't, when you go to sleep, not much changes about your heart rate, your pulse, your blood pressure. A little bit, but not much. Protein synthesis in your neurons. All of these chemicals that your neurons make so that they can release, so they can send signals, that picks up a little bit while you're asleep, because why not? Those neurons aren't busy doing other things. That's a good time for them to make more proteins and so forth. 25% of the U.S. population experiences sleep disorders. That's probably true. I think we didn't know anything about sleep disorders until about the early 90s. There was no such thing as a sleep lab anywhere until the early 90s. It's a pretty new science, And then sleep labs started showing up for this problem and that problem, and I think it really made a huge difference in the lives of a lot of people. Let me just tell a story about a guy. When the sleep lab first opened out in our town, out in the Dalles, there was an internist, Tom Hodge, really a good guy. He went off and got a bunch of extra training, and they bought all the equipment, and they started testing people. And he developed a real interest. In fact, I think it's still mainly what he does today. But he he brought a patient one time to a medical society meeting, and I had never really heard of sleep disorders. I'd be honest with you. I'm a surgeon. What did I care about sleep disorders? But he brought this guy in. He was a farmer, and he said, he just said, I want to interview him in front of all you doctors. He's agreed to answer my questions and talk about it. And see if you can pick up on some of your own patients that don't have a lot of these same symptoms. And he said, I don't remember his name, Charlie. Charlie, what's life been like for you for the last 5 years or so? He says, well, it's been pretty good. You have any troubles? He says, well, not really. Do you sleep okay at night? Yeah, I sleep fine. Well, does your wife still sleep in the same room with you? No, she moved out about 5 years ago because I snored so much. And it really bugged her because I would snore really loud, and then every so often I would kind of stop breathing for a few seconds, and then I would start breathing again, and it would wake her up. And so finally she moved across the hall into another bedroom, and so we've been sleeping by ourselves. And he says, yeah, okay. Well, what do you do? He says, well, I farm. And I said, do you ever have to stay up late? He says, yeah, sometimes. He said, do you ever have the need to nap? He says, I'll be honest with you, Doc. If I'm going to drive from here to Astoria to deliver something, I build into the schedule about 30 or 45 minutes of time for me to pull the truck over to the side of this road and take about a 15-minute nap. And I'll just take a nap. I wake up. I feel great from it. I get back behind the wheel and start driving again. But it does extend my day, because I just got to take those little naps along the way. And by the way, Charlie, do you drink any coffee? He says, yeah, I drink a fair amount of coffee. How much do you drink? He says, well, I usually drink a pot for breakfast, and I drink a pot for lunch. And Charlie, do you take caffeine pills or anything else to get more caffeine? Well, no, I don't take any pills. Do you drink any Cokes? He says, oh yeah, I drink about 15 Cokes a day. And you're just kind of calculating how much caffeine that is. And what you realize is that Charlie was having sleep apnea. He was snoring a lot, and he wasn't getting any good sleep. He didn't realize it, though, because that's the thing. The person that has the problem thinks they're sleeping just fine. Now, he realized he was drinking a lot of coffee, but he just thought he liked coffee. He was drinking a lot of Cokes, but he thought he just liked Coke, And it was impacting his family, the kids and everybody were really impacted by his sleeping and his needing for naps and all the coffee and Cokes and stuff. So I think that the point I make here is that sleep disorders are really a big deal. I think we're probably going to find one of these days that maybe 10% of all trucker accidents, semi-trucks, it's because the drivers fell asleep because they had sleep problems and they weren't getting good sleep and they would nod off on the road. There's sleep labs now in most every hospital in America. And does anybody know how you treat sleep apnea? Yeah. CPAP. What does CPAP stand for? Anybody? CPAP. Continuous. Positive.
Air pressure.
Airway pressure. Now, what they do is they wear a CPAP mask, and it's hooked up to a little pump, and that pump blows air, and it constantly blows air into this mask, which then keeps a little positive pressure going, and what all that does is these folks, most people who have sleep apnea are heavy, and their airways, they just kind of fall together and they're blocked, and so they don't breathe all the time. And then every so often they get hypoxic enough, their PO2 gets low enough that they suddenly breathe and make all that noise. And it keeps them from going down here into these deeper layered levels of sleep, so their brain really doesn't get to rest well. This is you guys can look at, these are EEGs. I don't expect you to be able to interpret these things or anything, but when we're awake, our brain is buzzing right on along, and when we go into REM sleep stands for rapid eye movement sleep. So if you could watch your eyes, even though you're asleep, your eyes are looking all around, you're concentrating on things. That's when you dream. Most of our REM sleep is in the early hours before we wake up. Then deep sleep is when we really slow our brain down, as illustrated there. So here's the REM sleep, comes on in little short bursts, 4 a.m., 6 a.m., later in the night is when we get most of our REM sleep. REM sleep is really good for us. It's what really rests our brain and makes us feel better. CPAP. They let CPAP machines go on airplanes now. You can check it in, and it's a big deal. It's a big business, I guess I could say as well. I think I've said all I need to do here. Deep sleep, our heart rate, it's almost like hibernation. Our heart rate, blood pressure, respiratory rate slow down quite a bit. I didn't tell you the end of the story on Charlie. The end of the story was, he said, Charlie, we gave you one of those CPAP machines, and how's that working? He says, well, I'll tell you, Doc, you're not taking it away from me. I've never given this thing up. I've never felt so good in all my life. He said, I wake up in the morning and I feel great. I've never felt like that. And I feel like I can, do all kinds of things. My wife has moved back in with me. That's kind of nice. He said, I'm not drinking as much coffee and cola and all that stuff because he was getting to sleep. And he says, what's really great, when I drive to Astoria and back, I can allocate 3 less hours to get over there and back because I don't have to stop and take a bunch of naps along the way. So, sleep disorders are a big deal. I think I've said all I want to say there. I showed you that REM sleep usually only just averages about 5 minutes in length. Maybe you'll get 20 minutes at a time later in the night, but enough said. One of the other systems that we have in our brain is called the RAS, the reticular activating system. It works from the brain stem. It involves different areas in the medulla and the mesencephalon, lower in the brain, and they basically keep us awake. And this is what the RAS kind of produces, widespread activation of the cerebral cortex. So you might think of the RAS as your awake center. Keeps you awake in your brain. And I think I'll just leave it at that. Let's talk some drugs here for a minute. There's this drug that came along in the 60s when I was in college called LSD. And it was a very powerful hallucinogen, and people were tripping out on it, thinking, oh, this is the greatest stuff in the world. It affected basically serotonin receptors in the brain, and it gave you this incredibly high high. The problem with LSD was that then a month later or 2 months later or the rest of your life, you would have these flashbacks and these secondary attacks where they were kind of like bad trips, whereas the first one might have been a good trip, the rest of them were usually bad. And so it kind of fell out of favor. Although some people continue to use it. The Beatles used it for a number of years and liked it. A lot of the great writers of that whole time used a lot of LSD, and they thought it made them really creative. I don't know. Never tried it. Let's talk about serotonin for a minute. Serotonin is one of the best drugs that we've got going for us. It's the one that makes us feel better than everything else. In general, if your serotonin level is high, you feel great. The reason that people get so wild and crazy when they do cocaine, or especially crack cocaine, is crack cocaine causes tons of serotonin to be released, and then they feel incredibly high. The problem with that is that crack cocaine is great for the first dose, and you get this incredible high, and then you spend the rest of your life trying to get that high again. You think, God, I want to do that again. That was so fun. And it takes increasing and increasing and increasing doses of crack cocaine or cocaine, either one, and you never get as high again because you don't have as much serotonin stored up. So if we could all take a little extra serotonin every day, we probably wouldn't have much troubles with depression and anxiety. And I would just say that the antidepressant medicines that many people in this country take, and I won't ask you to raise your hands, but I'll bet you a dime to 10 of you in this room take it. And I used to take it as well. The medicines are called SSRIs. And anybody know what the SSRI stands for?
Something
Selective serotonin reuptake inhibitors. Now think about it. If you don't reuptake your serotonin is loose in your brain. If you don't reuptake it, it stays there and you continue to feel good. So these drugs block the reuptake of serotonin so that it stays out loose in your brain and you feel better. This is a whole class of drugs, lots of them, and they have slightly different effects, but Celexa, throw me some names. Paxil, yeah. Paxil, Zoloft, Prozac, yeah. Wellbutrin is one. So anyway, there's a whole class of them now. And, you know, I have to tell you that me and the doctors and the Dals, when we were sitting around in the doctor's lounge waiting for the next OR to open up, as we would talk, we would always say, damn it, I wish we could put that stuff in the water system. Because the Dalles is one very depressing place. They have about a 3-month period of cloudy skies out there in the winter. And everybody got depressed. And we were passing it out like candy. Yeah.
And you said that it didn't make you feel good in the moment, but when you look back on it, like
exactly.
the last 2 weeks just weren't.
So I would, my problem was always the winter. The days were short, there wasn't enough sunshine for me. I think I have light affective disorder. And several winters I would go to my psychiatry buddy and say, you know, man, I'm really feeling down. I hate this. And he said, well, let's put you on something. So he would give me this medicine. And I didn't notice any difference at all for like 2 weeks, 2.5 weeks. And then I didn't really feel any different at all. But then I would think, wait a minute. I haven't felt really down. I haven't felt like there's this big weight on my shoulders. I haven't felt unhappy for a week now. And that's kind of the way it worked. It just kind of took that weight off my shoulders, and I didn't ever feel anything else from it. But, so then I usually wait till spring, and the days were getting longer, and the flowers were coming out, and the cherries were blooming, and I'd quit taking it, and I didn't notice any difference when I came off of it either. But they truly do work, and I think the problem is that there are many patients who've probably been overprescribed it, and that's always a problem on the other side of the coin. But my opinion, and I had a lot of cancer patients that, you know, you operate on somebody and you take out a big piece of their colon and you put them back together and you say, I'm sorry, Mr. Jones, but we didn't get it all. There's pieces of cancer left inside of you, and we're going to treat you with this chemotherapy, and maybe it'll make it better, and maybe it won't, but the odds are that it's not going to be all that great. You just wanted to put every one of those people on antidepressant, and many of them, I would offer it to them, and many of them took it, and they would take it till the day they died, and they really did feel better. I think it really helped people. Once again, I was a surgeon, I wasn't a psychiatrist or anything, but the cases that I saw, I thought it worked really great. Yes.
Right. Well, I was just touching back on what you said about living in the Dells. I used to live in Fairbanks, Alaska.
Yeah.
Which
I can't imagine anybody living in Alaska. I'm
it's
sorry.
so cool.
It's nice in the summer, but damn, it's dark in the winter. And
Well,
cold.
we'd get out for lunch at like 10:50, and the sun would just be coming out, and we'd get out of school at 2:15, 2:30, and the sun is already starting to go down.
I was in the Navy one time in Iceland during the middle of the summer, and we would go out, and a bunch of us would go out and sit on the runway, or near the runway, and you'd watch the sun, and the sun would come down, and it would set like this. And then it would start going back up. And believe me, it didn't get dark. It's like sun in Iceland, Keflavik, Iceland.
Oh, it's like that in Alaska.
Huh?
You can go fishing at 3 a.m.
You can go fishing at 3 a.m., but damn it, you don't get any sleep. Okay. So anyway, here's another slide on this. SSRIs, Celexa, Luvox, Paxil, Zoloft. There's lots of them. Just remember that they work on this drug called serotonin. It's a chemical that lives in your brain. And if you don't reuptake it, and these drugs selectively keep your body from reuptaking the serotonin, then you have more serotonin in your body, and it makes you feel better. One last comment about Parkinson's disease. Parkinson's disease is a problem with dopamine. Dopamine is another neurotransmitter in the brain. Dopamine is really stimulated by amphetamines or speed. When you take a dose of those drugs, it causes a massive release of dopamine, and dopamine is like a lot like serotonin. It makes you feel great. The problem is with dopamine, if you don't have enough dopamine, then you get what Michael J. Fox has. You have Parkinson's disease. And another famous guy who has Parkinson's disease is Muhammad Ali. And, the characteristic movement of Parkinson's disease is what's called pill rolling, where your fingers kind of do this movement right here. And it's really the only thing that causes that. So if you sitting around and see grandma or your aunt or somebody doing this, they probably ought to think about getting evaluated for this. The problem with Parkinson's disease is we haven't been able to find a slow-releasing form of L-Dopa. L-Dopa is the drug that you give people. And they have to take about 6 doses a day. So every 4 hours, their level goes up and then goes down, and then you take another pill, 6 hours, and so forth. But if you go 8 hours, it goes way down. If you take it every 3 hours, it goes way up. And human beings are not very good at taking pills. If you write a prescription for somebody to take 1 pill a day, you've got about a 70% chance of them actually taking it once a day. If you tell them to take 2 pills a day, you have about a 30% chance of them actually taking 2 pills a day. Not taking 3, not taking 0, not taking 1. And it just goes like that. If we had a Parkinson drug that you could take once a week or something like that, and you could really stabilize their level of dopamine in their body, patients would do much, much better. That's probably going to be the way this drug is cured, this disease is cured, is by pharmacologically figuring out a drug.
Have they tried a patch or something?
Oh, I think they've tried everything. Yeah, they have. And I don't know, I'm not up on the research as to what's happened, but I still know that's a major problem with it.
Is it just because the body's processing the L-DOPA too fast, or no matter the?
Or not making it. I think it's not making it well enough. So you've got to give it to them.
Well, no, I'm saying, but like if you give them a patch of L-DOPA, is the body breaking that
some
down?
drugs can come in through the skin and some can't.
Oh,
And that may be what the issue is. I think I've showed you guys this picture before, haven't I? Yeah. I forgot I had it in here. Anyway. Yeah, they're still having a good time. They're going to come back and talk at my, I try to put together a conference every winter, usually in January or February, where I invite a number of students that came through here and went on to school at different schools and have them come back and talk about what it's like. I think you'll find it interesting if you get a chance to come to it. We always videotape it so you can watch it even if you can't come to it. Okay, we're done with the brain. That's the end of the chapter. So this is the end of the material that will be on the test on Tuesday. The labs, I haven't walked you through all the labs. I would suggest that you take a look at the lab on reflexes. I believe there's one in there that talks about different sensations and reflexes. I think that's worth spending a few minutes going through that lab and doing that. Any other questions? Okay, I think we'll just go on and do the little quiz right now, and we'll have that done. And here we go again.
It's on premium.
Mostly on chapter 4. Chapter that has the training.
I'm studying so much for this. I do poorly then. I love you doing the other. No, I didn't. I didn't even realize it.
Can I ask you on this test to write your answers out here, the letters on the little blanks that are out to the side. Don't just circle the answer. It's easier for you. The most disgusting You're welcome.
Jeez, just throw it at her.
That's right. Okay, we'll take about 12 minutes or so on this.